How would you like to never pay for another oil change or tire rotation, or tires for that matter? We've got you covered at Davenport Auto Park. With Davenport for life, you can drive a brand new Honda, Buick, or GMC and never spend another dime on maintenance. With payments starting under $200 a month, what are you waiting for? Another service bill? Save that money for something fun. Head to the auto park and see how easy it can be. Come by and see us or visit our website. Davenport Auto Park, Rocky Mount.
Thank you for joining us, and this is a really exciting day for Nash UNC Hospital. We have got the opening of the Women's Center. It's beautiful. I walked down the hall coming to this interview, and the rooms are large. There's a piece about it. Larry Tooney, CEO here. I mean, we all just said, wow.
Yeah, it's a long-awaited day, and we're very proud.
Absolutely, and we are very happy to be joined by Chris Ellington. And Chris, you are the president of UNC Healthcare Network Hospitals.
Correct.
And so when we have all of our Board of Commissioner meetings and whatnot, you're the representative.
That's right.
Who comes here. And we want to ask you a few questions because lately the buzz around Rocky Mount and surrounding areas is, wow, we're seeing a lot of energy around the hospital. The UNC partnership is adding a whole new level in people's minds and in reality about the level of expertise here. Is this just the beginning of what we will be experiencing?
It should be just the beginning. As we team up with the staff here at Nash, they really set the foundation up to move this hospital and help the community move forward with healthcare and where healthcare is going in the future. That's what we're working on right now, making sure that we have the right specialties and the right physicians, the right clinicians here locally to keep care locally. And when you can't get that care locally, we're here to help with some of those harder things that are done in academic medical centers or tertiary medical centers.
Well, and even like in replacing, we've got have had two vacancies recently, high-level vacancies.
Right.
And you all, with the UNC Gravitas, have gone out and brought in outstanding candidates for us.
One of the benefits of being associated with a system like UNC, a large system that really can get down to the granular level locally very quickly, is that expertise and depth. And luckily, we've been able to support Nash when they have had those openings quickly with high-level, competent individuals that reside in Nash County, reside in Rocky Mount, and really culturally fit here and call this their home. That's what we're after.
Well, and we're seeing it. And Larry, I know when the comments that are made at the board meeting of the speed with which we get, you were even talking today about some just incredible candidates we're getting.
Yeah, it's one of the huge benefits that we really, we knew we were going to get the ability to attract new physicians and professionals here with the UNC relationship, but the speed with which that has come has been absolutely amazing. And it's just, when you put the old well and talk about UNC and all of the great things that represents, it just attracts people from literally all over the country. So we're very fortunate.
I want to ask Chris, the mission UNC is the public, it's the People's Hospital for the state of North Carolina. Our taxpayers support it. I can tell you from having known people at Chapel Hill for a long time in healthcare, there's a real feeling of we work with the people, the public is our priority. And as you all are expanding your footprint across the state with hospitals such as ours, how many affiliates and how many partners does UNC have now?
Sure. As we've started to expand, the legislature certainly certainly helps the school, and we're growing physicians. And our role is to try to keep those physicians in North Carolina, but to have enough teaching opportunities for them, we have started to expand in the way that healthcare is changing in America and in our state. We've needed to expand, so we now have 12 hospital entities that are associated with UNC, and maybe in the order of 3,000 physicians.
Wonderful. And is that some of the smaller hospitals, and I guess, Larry, I'll switch to you on this, for a hospital such as ours to be able to link and benefit from all that they avail we were very solid before this happened, but this just takes us where we are, helps us be more fiscally responsible, and just starts elevating the whole environment, doesn't it?
And we all learn from each other. I mean, what has been, one of the most kind of gratifying part of the relationship is that the folks in Hendersonville or the folks up in Lenore may do a clinical process better than any of us, and so we all sit down and learn how to take care of sepsis patients and minimize the amount of time people have to wait in the ED. So it's everybody is equal from that standpoint. So again, every time we get together, we all go away learning something from each other, which is just great.
I remember when we had a meeting in Chapel Hill in November, Dr. Roper, who is the CEO and the Dean of the Med School, and he basically looked at us and he said, "We've got your back." And what a wonderful feeling to be sitting there knowing with compassionate care, access. When Chapel Hill was, the medical school was started a long time ago, it was a training and research ground for specialists.
Right.
And so to have that right in the center of our state and have that as our partner now is just phenomenal. Welcome back to the new Women's Center at Nash UNC Hospitals, and we are joined by Dr. Chris Chandler, OBGYN with Nash OB.
Yes, ma'am.
And also Mary Strickland. Mary, you are the Executive Director of the Women's Center.
Yes, ma'am.
And in talking to you last night, in fact, we're continuing this today because of all the wonderful festivities with the ribbon cutting and everything. You were telling me, and I found it so fascinating, that you were involved with a team who behind closed doors for a week laid out this center. Tell us about that.
Yes, ma'am. We put together a team from the Women's Center, staff nurses. We brought in ancillary departments like pharmacy, for example. We brought in ultrasound radiology. The architects brought their team together. The construction individuals came, and we sat around tables, and we built it first out of small cardboard and made tabletop models. And then towards the middle of the week, they brought in the larger cardboard kits, and we actually built a room. We built a triage room, we built a labor room, we built the operating room, and a mother baby room. We brought over equipment from the Women's Center to make sure things would fit. Pictures were taken, and the architects were there to help ensure that, okay, you can't do that because of code. You can't do this because of code. So that we knew from the beginning some of the rules and the ground rules so that we would meet all the requirements for the inspections.
Well, all the expertise that you've had previously before moving here, the wisdom of years, including yourself, are all coming over here. And what is it like, Mary, to be in this beautiful new facility?
It is probably the most exciting thing I've been involved in I've been a nurse for 30 years. In June will be 30 years. And if you'd asked me 30 years ago, would I need to know anything about architectural designs and codes, I would have laughed at you. But I've certainly learned a lot. It's cool. I'm excited that the board gave us this opportunity. They took this chance. I'm excited that the physicians have been as involved. Dr. Payton, one of his partners, was very intimately involved in the beginning, and Dr. Chandler, since he has become chair, has stepped right in. So I think it's just a great testimony to our organization that says, you guys come together and tell us what you need. And that's exactly what we did.
Well, and from my perspective, there's no other way to do it because you're the ones living it day to day. And so the physicians were involved and had, said what you needed, what would maximize, Dr. Chandler, your ability to provide the best care.
Absolutely. We take care of women in OBGYN, and we all know who makes most of the decisions in the household is typically women, especially when it comes to health care. Most guys I don't want to go to the doctor unless they're being forced to. What better way to show the community how much we care about the family than to show we care about the moms and their children. So enabling them to come to a nice facility also helps demonstrate them coming to Nash for other services later in life or for their spouses when he has an issue. He won't be coming to the Women's Center, but still we can still help showcase Nash for what it's worth.
Well, from your perspective, there are not many places that have a facility this nice, are there?
Absolutely not. We top of the line, state of the art. It's expansive. I think we might have trouble people wanting to go home. They might want to stay here. I don't know. I mean,
Well, I offered last night. I said, hey, it's raining and I was going to drive out of town going home. I think I'll spend the night. I mean, the rooms are magnificent.
absolutely, yeah.
They're large. Kind of tell us, I think there's several different types of rooms here. Mary, what are the different types?
Well, we have a triage area, and those are the rooms for those patients that come in that just need to be checked out quickly. Maybe they need a test done. Maybe they have a minor little issue going on that we can bring them in, check them out, give them what they need, and then let them go home. Then we've designed our labor room area for them to actually come in and have their baby and for their family to be with them. Then we have the mother-baby area where the moms and the babies stay together as a couplet, as a unit, and are cared for together. And then we have our special care nursery. You know, some babies are born that need just a little jump start. Maybe they need a little bit more help with their respiratory system, or maybe they're little and they need to gain some weight.
Is that the neonatology?
Yes, ma'am.
Okay.
And so we
that's
will.
Great that we have that here, because in the past people would have to go out of town.
That's correct. And now they don't.
Wonderful.
And I've been very pleased with being able to offer that to the community so that those families can stay together. And every room, in any of those rooms that you go to, if you were to walk to any of those rooms, they've all had the same design behind them, a family-centered approach. There's a place for the patient, a place for the family, and then the caregiver has what she or he needs to take care of them all, so that it's very lean. We actually, before we even started with the cardboard, we actually walked through scenarios and documented steps and documented supplies, so we would know how to design those rooms so that the nurses could go into each room and have exactly what they needed at their fingertips.
Boy, that's just great. I've heard some changes like that. Sometimes instead of going to an actual OR, that sometimes women have babies in their rooms and the room can be changed to an operating room. Did y'all opt to do that or not?
So several years ago, or back in the day, they used to do, you would labor in one room, and then as soon as you got ready to deliver, you would go to an operating room or a quote-unquote delivery room. The models have gone past that now. Now the labor rooms are now LDRs, or labor and delivery rooms. We do have an OR where if you were to need a C-section, or for instance, or twins, we have multiple babies kind of coming at the same time, then we typically would take them back to the operating room itself. And then we have a recovery room for where they would then recover together, in a recovery room separate from the labor and delivery room.
But the labor and delivery room then, if in a normal delivery, unless there's something that you, like a C-section or a multiple birth or whatever, they can actually just stay in that same room?
Yes, they can. And then after about 2 hours, we will take them to the mother-baby unit, where they will stay with their baby in that room for the remainder of their stay.
I would think that this would really attract women from a broad range to know that, especially now that we're Nash UNC, we're bringing in more resources all the time across the board with practices even owned by UNC. But don't y'all anticipate that this is just the beginning?
Yeah, we certainly hope so. Hopefully, the theory is you build it and more will come. We also have, in addition to a great labor and delivery and suites, we also have 2 breastfeeding suites and lactation nurses. So they will help here in-house while they're breastfeeding. But if they go home and they're still having issues, we'll have a clinic where they can come in and ask and make an appointment, or come in and ask questions. I'm having an issue with this breastfeeding, or this is kind of going on. So we'll have that facility. We have great conference room now where we can have education, both childbirth education, maybe even some pediatric education, where we can help educate the community as well.
I know long time ago, when I was having kids, we had classes where we would learn how we could help in assisting delivery, like with having the least amount of anesthesia and whatnot. Are those classes held here?
We will be holding those classes here. We have recently hired a perinatal educator, Jennifer Kendrick, and she is currently working on her curriculum. She has her certification in perinatal education, and we hope to get that program up and running very soon.
And about how many OBs practice out of, or deliver babies out of here?
Right now we have 8 that practice and deliver here.
Wonderful. And they're all from local practices, and
Yes,
they
ma'am.
come here. So you're available all the time, right?
Yeah, most of the time. There will at least be 1 OB here, at least all hours of the day. And sometimes there's more depending on the situation.
That's right.
Absolutely.
We have 6 labor and delivery rooms. So I suppose if there are 6, it's hard for one person to catch 6 at a time.
Well, now, if 6 were going at once, Mary, let's talk about staffing. What's the most you've ever had?
In a day?
Uh-huh.
In a 24-hour period, I think around 13 or 14 is probably the most I've ever had. We typically have about 3.3 babies a day. I mean, if you statistically analyze it. And with that being 3.3, that means there are days there's more than 3 and days there's less than 3. Wow. A busy day is 6 or 7. A busy 24. When you start getting into double digits, you've really you exhausted a lot of resources. So.
Oh, well, we're going to take a break, and we'll be right back.
Hi, I'm Richard Koss, Pharmacy Manager at Almonds Drug Store at the Westridge Shopping Center. Here with my wife, daughters, and my business partner, Brad Hilton, and his wife, Katie. We are delighted to be new business owners living in Rocky Mount and are excited about the new services and products we are adding at Almonds Drug Store's 2 locations. With a full-service pharmacy, a large supply of over-the-counter supplements, and a comprehensive line of diabetic supplies, Almonds has you covered. Our pharmacists also specialize in consultations. We want you to pay the lowest prices and get the best service in town, and our staff works hard to help you save money, but we are also big on friendliness and customer care. We will deliver your prescriptions free, have drive-through windows, and guarantee short wait times. And we come out to greet you personally and see how we can answer all of your questions. Because as local business owners, we care about you. As a loyal member of your community for over 70 years, you can count on Almonds Drugs to make the health of you and your family our top priority.
Please call Almonds Drugs today.
443-3138.
How would you like to never pay for another oil change or tire rotation, or tires for that matter? We've got you covered at Davenport Auto Park. With Davenport for Life, you can drive a brand new Honda, Buick, or GMC and never spend another dime on maintenance. With payments starting under $200 a month, what are you waiting for? Another service bill? Save that money for something fun. Head to the auto park and see how easy it can be. Come by and see us or visit our website. Davenport Auto Park, Rocky Mount.
And we're back, and during the break, I really want us to share, or want Mary to share and Dr. Chandler to share about how wonderful and well qualified the staff is here. Mary, brag on them. I mean, they're worthy of being bragged on.
Yes, they are. I tell them all the time that I believe they're the best staff in the country. I would put them up against anybody. I think one of the things that I'm most excited about is their participation that they have had with the design and the go live for our new facility. They have a heart and soul that have just, they have just been right here with me side by side. And I think secondly, the thing that I'm also very excited about, I have a lot of longevity. I have a lot of nurses that have been nurses for a very long time. They're very seasoned. They have wisdom beyond discussion. And then I think finally, I have a lot of nurses that are certified in their specialty, and they're certified as instructors in our specialty. I have my own fetal monitoring instructors on staff. I don't have to send my staff out to learn about state-of-the-art fetal monitoring interpretation. I have those experts here. I have certified instructors for OB advanced cardiac life support. They are right here on staff. I don't have to send them out to learn that. I have the experts right here. So I would say they're like my children. I'm as proud of them as I am of my own 2 children that I gave birth to. And I'd put them up against any staff in this country.
Well, and that's very reassuring, because Dr. Chandler, with working with women all day, every day, these types of things are really important, aren't it?
Absolutely. It's great to know who's calling you and you trust them. You trust their interpretation of what's going on. If you're dealing with one emergency, one situation, and there's another going on, you can trust that, okay, this is my assessment, and this is what you need to come now, or you need to come when you're finished, sort of assessment. It's great that they have that expertise and you can build a trust, and there's a lot of teamwork. We value their input just like they value ours, and we're respectful of each other, and teamwork is a great deal. It's much better than the tyranny that sometimes people think of as, well, I'm here, it's my decision, goes. We value each other's opinion a great deal.
And there's somebody who can do the anesthesia here 24 hours a day, isn't there?
Absolutely, and which I think that's what sets us apart from anywhere, probably in the state, is that we have a dedicated CRNA to labor and delivery that never leaves labor and delivery. So if you want an epidural, as long as you're able to get one, you can get one in the next few minutes, provided he or she's not providing another service in
They don't
another
have
room.
to call them from the other
But
part
they
of
don't
the
have to come
hospital.
from another part of the hospital. They don't come from home. If it's 2 o'clock in the morning and there was nobody here and you come in and you're the only person here, they're still right down the hall. You get it as soon as you want it, as long as there's somebody else not ahead of you in line getting theirs, or a C-section kind of going on. So that's great. And it's great for patient safety. I mean, if for some reason you come in and you're hemorrhaging and you need to go to the operating room, you don't have to wait this few extra minutes for somebody to come from home or somebody from coming down the hall. They're right there with you as soon as it happens. So it's great for patient safety.
And that's always, anybody who comes here and utilizes this facility for labor and delivery will be able to have that.
Absolutely.
Yes, ma'am.
A
We
lot
have
of
that now. We do have
We
that
do
now.
A lot of hospitals claim they have 24 anesthesia services available. And they are available, but they may be available in 20 minutes when they come in from home. But ours is 24 hours available in-house, on site.
One thing you mentioned also during the break was the fact that instead of having to go down the hall or anywhere to get showers and whatnot, tell us what's here now.
So here now, Nash was the first hospital in the state to have private rooms. However, when they built private rooms, they didn't build private showers. The new Women's Center has a nice posh hotel-like room with a posh shower, walk-in shower, and all those sort of things. So now they can have their own shower and not have to walk down at the end of the hall, which is currently what's going on now.
And having gone through labor and delivery, and you might not be getting as much sleep as you want and whatnot, to be able to not have to, just have that privacy of you're right there in your own room and you can take care of it when you want to. And that's just, how long do people stay when they give birth normally?
Depends on how they deliver. Typically 48 hours. Depends on what time of the day. If they deliver during the early, in the breakfast hours, let's say, they might be able to go home the next day in the afternoon. If they
Might not want to.
They might get them out. And if they have a vaginal delivery and they're delivered late at night, it may be 48 hours. Typically 48 hours, 24 to 48 hours. Cesarean sections usually are 48 to 72 hours, depending on the situation and timing. We don't like to kick anybody out at midnight because they're hit the clock, so it'll be the next morning for someone.
Well, and a lot of people have heard about hospitalists. I know in some of the areas that if people have had family members here and whatnot, instead of having their regular physician, there are hospitalists here who are extremely well trained. But you don't utilize them here, right?
No, ma'am. There are 2 practices in town, and we each take care of our own patients. So hopefully you've met the physician that's going to deliver you at least once in the office.
And hopefully more than that.
Hopefully more than once. We deliver our own patients.
Mary, tell us about the neonatology. Kind of explain a little bit more about that.
Well, in 2012, we opened up our special care nursery where it currently is, and we had a partnership at that time with Duke. And now that we have UNC, we have that partnership, and they have Dr. Reddy on staff for us, and he is a neonatologist that practices in our special care nursery. He works alongside of nurse practitioners, neonatal nurse practitioners that are also hired by UNC that provide him with some support during the week.
And speaking of UNC provides, I think it's one thing that Chris Ellington earlier in the interview mentioned, but when I want to reiterate the fact that UNC has got our back. I mean, when we need to look for somebody and hire somebody, instead of hoping that we can use our resources and go out and find somebody, UNC, actually the parent hospital is recruiting for us.
Yes, ma'am.
And finding state-of-the-art people. So I think I know the future is really rosy.
They've done a great job recruiting our pediatric hospitalists. They actually care for our newborns and our well newborns, and they care for our pediatric population in the tower. And so they have done a super job recruiting the pediatric hospitalist team, and they are just wonderful, and our patients really do enjoy working with them.
And what's the date you'll start doing deliveries here?
We are hoping for May the 16th, which is a Monday. That is not 100% in stone, but we're looking real hard at being ready and operational on that day.
And I bet, are your patients talking about it, Dr. Chandler?
Oh yeah, they you know, who wants to be the first person delivered here, and they want to deliver in the nice posh area. Now I will say that some are probably saying, I just want to have my baby. I'm tired of being pregnant. I'm ready to have my baby. So yeah, they talk about it, and everybody knows when, okay, am I going to deliver there or here? Where am I supposed to go? And we can say, well, we'll let you know.
Well, and to walk into this beautiful state-of-the-art facility, and in my experience in talking to people with UNC and certainly the staff here, is that y'all are going to continue getting everything you need to maintain this level too for our community. So
Yes,
folks,
ma'am.
we are really fortunate. Tell all your friends who are getting pregnant, who are pregnant, that this is where they need to come.
That's exactly right.
And they will welcome you with the best staff ever, right?
That's exactly right. It's more than just bricks and mortar. It's really a place that we feel we will serve the community. It's beautiful. The paint, the colors are awesome. But what's behind all that is the care that they'll receive.
And the love.
Yes,
I mean,
ma'am.
you
And
feel
I'll
the love
stand
when you
by it.
come in. Great.
Thank
Well,
you,
thank
ma'am.
you so
Thank you
much.
very much.
Thank you.
Thank you. See you next week.
How would you like to never pay for another oil change or tire rotation or tires for that matter? We've got you covered at Davenport Auto Park. With Davenport for life, you can drive a brand new Honda, Buick, or GMC and never spend another dime on maintenance. With payments starting under $200 a month, what are you waiting for? Another service bill? Save that money for something fun. Head to the auto park and see how easy it can be. Come by and see us or visit our website. Davenport Auto Park, Rocky Mount.